Okay. So this presentation is going to focus on evidence-based interventions to reduce and replace challenging behavior. We're going to talk about a lot of different terminology of what ABA is, different procedures that we can use within ABA, and kind of explaining some of the different topics from applied behavior analysis. So just to start off with, applied behavior analysis is how everyone learns. Behavior analysis has been around for years. It's rooted in behavioral psychology. It's how everyone learns. It's how we put and skills together and build upon them and learn. It's used to change existing behaviors and then also to teach new behaviors. It uses both reinforcement, the principle of reinforcement to increase the occurrence of behavior, and then the principle of punishment to decrease the occurrence of behavior. We use prompting to create positive practice. So to start off with behavior, just the definition is an organism's interaction with its environment. So things to remember about behavior: it's observable and it's measurable. If you can't see it and you can't measure it, it's likely not behavior. There are things that happen inside of our bodies, things like breathing, things like our heart rate, but those are where those might not be observable. They can be, and they can be measurable, right? If I take hook someone up and take someone's blood pressure, or if I take their pulse, right? I can kind of measure those things. Those things are considered behavior. When things are not considered behavior, we use the dead man's test to determine whether or not they exist. So can a dead man do it? So if a dead man can do it, it's not a behavior, right? So just laying on the ground and not responding to you, being quiet, not paying attention, those types of things are not examples of behavior. Yes, those are things that we could see our kids maybe doing, but it's not acting. So we want to look at what are they, how can we define and measure what those things are? So if a dead man can't do it, then it is a behavior, right? So getting up out of your seat, talking, engaging in some sort of off-task behavior like talking out or looking around the room, or fidgeting with objects. Okay, reinforcement. Reinforcement is just a simple principle. It's an event that occurs immediately following a behavior that increases the future occurrence of that behavior, or some quantitative dimension of that behavior. Maybe the child engages in something longer, or maybe the child engages in something more frequently, right? So if it's increasing some dimension of that behavior, then reinforcement is occurring. So when we were younger and we first started learning how to wash our hands, right? If we had wet hands and then we rubbed our hands in a towel and then the water was gone and our hands were dried, that was the principle of reinforcement, right? Immediately, that was a desired response after rubbing our hands in a towel, them being dry. And next time our hands are wet, we are more likely to go grab a towel to dry them off. And a lot of these examples are just to show how reinforcement has occurred naturally within our lives, to explain some of the principles. Punishment is the sort of the opposite of reinforcement. It's an event that occurs immediately following a behavior that decreases the future occurrence of that behavior. And these are kind of some simple examples of punishment. Typically, when we think about punishment, just outside of behavior analysis, a lot of people think about things like yelling at a child or putting them in timeout. And yes, maybe those can have some punishing effects on behavior, but that's not what we're talking about in behavior analysis. So for an example, the first one is your typical aversive reaction. So you touch a hot iron, your hand is burned. You're not going to touch that hot iron anymore. You're going to be a lot more careful. Same thing with the stove and cooking, right? After you burn yourself, we all know we only have to do that one time before we're extra careful that next time. The second example is kind of one that's more likely that occurs naturally. So if you're walking around very careless with your ice cream cone as a child, and all of a sudden that ice cream falls on the ground, the next time you're not going to be careless. You're going to hold that ice cream straight up, most likely, because you don't want the top of that ice cream to fall on the ground. That is a very natural example of punishment, right? So that no one had to kind of tell her. Maybe someone said, hey, make sure you hold your ice cream like this, but you learn because you don't want the thing that happens next. So what is problem behavior? Now that we've talked about behavior and reinforcement and punishment, and is behavior a problem? So for those of you that don't know, we do have behavior specialists at our school. I hope you all know that right now, but we also have behavior analysts. Behavior analysts are those that are credentialed through the Behavior Analysis Certification Board. They went to school, did coursework within behavior analysis, did like a practicum experience or an independent fieldwork experience. They accrued 2,000 hours. They met with the supervisor and had a lot of supervisory experience, and then they passed a board exam. So if behavior is serious or harmful, we want to make sure that we're consulting with the right people before implementing an intervention for behavior reduction. So the link to the BACB is right there, but we have behaviorists and behavior analysts right at Monarch, but just want you guys to be aware of that. Okay, Houston, we have a problem. So when are behaviors considered a problem? We typically look at behaviors as serving a problem if it limits the person's access to the things that they like to do or things that we would maybe refer to as reinforcers. So if they can't do the normal things that they do, or they can't have the normal things that they have because of their behavior, then it's something that we should address, right? If a student throws an iPad, if the student loves the iPad but throws it every single time that they have it and breaks it, then that's limiting their access to some sort of enjoyable activity. And we should probably work on that throwing behavior. It can also be a problem if it interferes with learning new things. So if we can't actually, if a student's not in a place so that they can sit down and we can teach them things, then we need to work through those behaviors that are occurring that are preventing that. If it limits the person's interaction with peers or with their family, we think all the time about our residential kids that are living on campus here. They're not able to live with their parents or their family because of some of the behaviors that have been occurring. So we have a responsibility to kind of address those things and see if we can change those behaviors so that is able to happen again. And it limits the family from enjoying things together. There are other reasons why we would address behavior, but those are the main ones. We don't address behavior if it's just, annoying to us, or if we don't understand why they're doing that, or if they're doing it and they don't look like everyone else. We want to make sure that we're really focusing on these things that are impeding quality of life for that individual. So we have a problem. Now what? So one of the first things you want to do is you want to identify what that specific observable and measurable behavior is. So sometimes when we're talking with teams, they might say, well, they're just like not doing their work, or they're not being a good listener, or they're just out of control. Those aren't good. Those are, yes, to someone else, you might be able to picture what that means when you say those things, but we want to know the exact things that that student is doing. So what is the specific observable and measurable behavior? What is that thing that they're doing in order to figure out how we're going to address it? Once we've addressed or picked out a problem behavior, we want to be able to measure it in some way to get an idea of where this child is at with baseline, some sort of baseline data. So we can look at a variety of different data collection methods, and we're going to go through some of these in the next slide. So the first is just using the 3-term contingency to analyze behavior. In behavior analysis, we talk about antecedents, behaviors, and consequences all the time. That's the 3-term contingency. There's actually a 4th-term contingency as well, which includes the use of motivating operations prior to the antecedent. So what might be motivating me in that way? Am I hungry? Am I thirsty? What is it that's happening? Am I bored? Have I been sitting too long? So sometimes we're bringing in that additional motivating operation as well. We can look at rate or frequency. We can look at latency, duration, partial interval. There are other methods of data collection, but these are the ones that we use most frequently at Monarch. And we're going to go through those in the next couple slides. So when we think about ABC data or collecting antecedent behavior consequence, we need to know what an antecedent is. An antecedent is an event that occurs immediately prior to the behavior. So in this kind of example, the child is swinging at the park and a plane flies over, and then the behavior might be that the child is crying. Sometimes those antecedents are very obvious. Sometimes it's very clear, like I said to this child, you need to stand up and go get your backpack. And sometimes the antecedents are not obvious. Sometimes the antecedents might be happening, they might be a private event. They might be happening within that individual, and we don't have the tools to measure or observe those things. So sometimes people call them internal things. In behavior analysis, they're called private events. So that might be something that you can't see that's occurring within that individual that's acting as an antecedent for that behavior. We really want to be looking around the environment and kind of trying to figure out what is it that might be evoking this behavior, so that we can record it on the sheet. Remember, the closer in time that it is to the behavior, the more likely that it's an antecedent that's evoking it. We've probably all been in those situations where we've been really, really frustrated, and it's kind of building and building. And that last thing that someone says to us, like, turns on our, like, we snap at them, right? So although there might have been something that's been leading up to that, it's that last thing. Like we always say, we couldn't take one more thing. So it's that last thing that evoked that behavior that we're having. So please think about that in terms of filling out that data, that it's something in close proximity to what's happening with the behavior. For consequences, those are events that occur immediately after the behavior. So in this example, the child was crying and then the plane leaves and the child is happy again. I think about that. Another example of that might be when I'm thinking about my dog's barking, right? My dog barks whenever another dog barks by. And I think what he thinks is his barking causes the other dog to leave, even though that dog is just on a walk. So he sees the dog, barks, 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 dog leaves. That's completely reinforced his behavior. He's like, yeah, I scared that dog away by my barking. He just does not realize that the dog is just walking anyway. So thinking about these things and applying them to different aspects of your life can kind of give you a better fluency with some of the concepts. Okay, so now that we know what antecedents and consequences are, we would want to determine how we can use that to kind of track ABC data. So with ABC data tracking, it's usually like, you can use an anecdotal observation. So there's continuous observation. I'm just watching this child. I'm writing down a descriptive account of here's what happened before the behavior, here's what happened, here's what the behavior looked like, and then here's what happened after. As events occur in the client's natural environment. And that will give me an idea of potential things that might come before the behavior and potential things that might come after the behavior. Frequency or rate is another way that we can measure behavior. And frequency or rate, now the behavior team uses rate a lot when we're talking about these, but frequency is a term that's more used outside by a variety of professionals. They're sort of interchangeable. But really it's a count per standard unit of time. So how many times an hour did that child do that? So they were hitting 5 times within this hour. They toileted 10 times within the school day. So just thinking about how many times versus what unit of time, and you're going to get a rate. You can also measure behavior by how long it lasts, and that's called duration. So the total extent of time in which the behavior occurs from the start of the behavior to the end of the behavior. And you can measure using a latency measure. A latency is time that elapses between the antecedent and the initiation of a response. So if I say, walk to your locker and get your backpack, right? After I've said that, how much time has elapsed before that child performs that behavior? That's called latency. A lot of times we use latency measures for things like transitions or following directions, because ultimately we'd like to shorten that period of time. We don't want to, I have a 2.5-year-old at home and I say, go get in the bath. And I don't want to say go to get in the bath and have 30 minutes elapse before he actually goes and gets in the bath. I want him to do it quicker. So I'd be looking at latency measures and figuring out how to decrease that amount of time between I say this and he does it. Partial interval recording is another frequent measure of recording that we use at Monarch just because it's very easy. You don't have to count things. You just have to measure whether or not that behavior occurred within that time interval or not. And that time interval can be anything. In research, it's usually very quick. It might be 10-second, 30-second intervals. Here at Monarch, we've kind of adapted it a little bit to sometimes be within either 5-minute intervals or 30-minute intervals. And essentially, if you have partial interval as the method that you're tracking for the student that's on your caseload, you're just marking like, did this behavior occur in this 30-minute session or did it not? Were they aggressive or not? Were they self-injurious or not? So it's a pretty easy, but also more reliable because it's pretty clear if the child did engage in that behavior or not. For behavior that is you have to count every single time, that can become a little bit laborious when you're trying to do other things as well. Like you're trying to click or count how many times they're doing a behavior while also teach them in the session. It reduces reliability. So that's sometimes why you might be tracking things, or behavior specialists might be tracking things using partial interval recording. Okay, so now we're going to really briefly talk about the different functions of behavior. So when we think about behavior, we usually think about that behavior serving some sort of function for that individual. It's functional. It's letting them get their needs or their needs met or their wants met. It's something that they've learned that through natural interactions with the environment. We tend not to think about behavior as intentional, or they're trying to do things. Oh, they're just trying to, do this, or there's some intent behind it. Instead, we really think about behavior as the child has learned through repetitive pairings and associations between these antecedents and consequences that this is just what happens. I do this and this happens. And this is either a positive outcome or it's a negative outcome. If it's a positive outcome, I keep doing it. If it's a negative outcome, I don't. So really taking away kind of some of like the intent that that we think our clients have when they're behaving the way that they are. We look at 4 main functions. So an automatic, sometimes you'll see this referred to as sensory within different contexts. I actually do not prefer that term whatsoever because I think it gets very confounded with other things. So I use the term automatic. There's an escape function, an attention function, and some sort of access to a tangible function. So we'll start off with the socially mediated ones. And when I say socially mediated, I mean other people are involved in the delivery of reinforcement or punishment. So when we're thinking about attention, when an individual engages in problem behavior, a lot of times attention is provided from a young age. My son is doing something that I don't like, and I'm immediately yelling at him and telling him to stop doing that. So that's a frequent consequence that's been provided over time. And if you have no other functional communication, and that's the way that you've been able to get attention, you can see why attention might reinforce this behavior, and why they might engage in the behaviors that they do if that's the only way they're getting attention. So attention can be direct attention, right? It could be a verbal reprimand. It could be an attempt to soothe that child or distract that child. It could be indirect attention, such as a startle response or a quick glance. We've worked with students in the past that raise their fist. The staff kind of gives a startle response, and that can be very reinforcing to a student. So when the individual receives attention after problem behavior occurs, it may increase the likelihood that that problem behavior occurs in the future under similar circumstances. And we just have to be aware of that. That's not to say that we should always use planned ignoring and never address a child with attention when they're engaging in a problem behavior. Not at all. We need to determine like kind of what is this function and what are things that we can do to teach them skills that they can get attention for, while we reduce this behavior at the same time. Okay, so here's kind of an example of problem behavior that might be reinforced by attention. There's a large number of students in one classroom with one teacher. The teacher's not able to give students a lot of one-to-one attention, right? So there's a deprivation of attention. going on here. Tim notices that when he throws something across the room, the teacher walks over his desk and reprimands him. He likes the attention. Next time when the teacher is occupied, he may throw something across the room again because he knows in the past the teacher will come to his desk and speak with him. It's sort of that thing where also when I'm, with my son and he's saying mommy, mommy, mommy in a nice way and I'm busy, I'm not I'm not interacting with him or addressing it. And then all of a sudden he's screaming mommy. And I'm like, oh, okay, that got my attention. I come over. Well, now he's just learned, like, if I really want her attention, I should just raise my voice and scream. So these things are just examples to make you think about things, not necessarily to tell you what to do in a certain context, because again, we want to look at kids and assess them at an individual level, but just to make you aware of relationships that exist between antecedents, behaviors, and consequences that might reinforce or strengthen some of the problem behavior that we're seeing. Another socially mediated function of behavior is a tangible function. And when I say socially mediated and tangible, it means it's the provision or giving of some sort of activity or item to students by someone else, or to someone by someone else. So when an individual engages in problem behavior, they may receive access to reinforcing objects. These problem behaviors can be reinforced in the past. Engaging in the behavior resulted in them gaining access to a desired item. An example of this, upon arriving to school, Sue asks her teacher if she can play on the computer. Her teacher replies, not until you finish your schedule. Sue begins to hit and kick her teacher. Her teacher allows Sue to play on the computer after finishing just one item. Next time Sue comes into school and her teacher tells her she cannot play on the computer until all her work is finished, she's more likely to hit and kick her teacher because in the past, the teacher lowered the demand and let her on the computer. Again, these examples are not meant to say like, hey, you should never do this, because I do this. I do this with my son all the time. If I want him to do these things, and then I say, okay, well, actually, you can just do this. And it's not to say that staff's responses to these things are wrong. It's just what we want to do ultimately, and the behavior specialists and analysts will do this, is analyze these things. Are these things only occurring in this context? Like, are they only getting access to computer in this small context? Because if that's what's happening, then we need to maybe change things a little bit. Okay, so the next behavior is not a socially mediated behavior. This function of behavior is automatic. So some behaviors are just reinforcing on their own. They do not depend on anyone else in the environment to reinforce or punish them. So examples of this might be having an itch and scratching your skin. So once you scratch that mosquito bite, right, all of a sudden it feels a lot better. No one had to tell you, hey, scratch that mosquito bite. No one had to be involved in those behaviors at all. It automatically felt better and you did it again. So when we're thinking about automatic behaviors, and sometimes they're referred to as sensory, I mentioned that before, it's because some part of your senses are engaged in that sort of thing. So your sight or your hearing, right? We listen to music because no one has to tell us, right? It doesn't have to be other people around. It's pleasing to our auditory system. And so we keep doing it. So things that engage your senses, and things that are, you do it and you like, they could be reinforced with an automatic function. Okay, the last function we're going to talk about is escape, and that's another socially mediated function, meaning someone else is allowing that delay or escape. So sometimes when an individual engages in challenging behavior, it postpones or it terminates an aversive event. And I think one of the things that's really important too, because I hear people say like, well, I never let him escape. He always has to go back to that work. But sometimes it's not a full escape. Sometimes it's, I just don't want to do this right now, right? I'll do this in 5 minutes, but I do not want to do this right now. So even if the behavior postpones an aversive event, it could still be maintained by that escape function. An example of this is an individual may hit a teacher when work is placed in front of him. This results in the teacher removing the work and giving the student a break. Now, when the student is presented with a task he or she does not want to complete, they may be more likely to hit the teacher because in the past, the teacher removed the work. Okay, so moving on with some of our terminology. Okay, so those were the 4 different functions that we talked about: attention, escape, tangible, and an automatic function. We're going to talk really quickly about a proactive strategy, or sometimes they're called antecedent interventions. So when the antecedent is changed to reduce the likelihood of the challenging behavior or increase the likelihood of a wanted behavior, we're talking about an antecedent intervention. And you guys will see this within the behavior intervention plans as antecedent interventions. And those are things of, okay, if we don't want problem behavior occurring, what is the antecedent that brings about or evokes that problem behavior? Let's change it. Let's either get rid of it, let's do something about it so that that behavior doesn't occur. The classroom checklist we use a lot, and you guys might see that within when you're working with your behavior specialists and behavior analysts, or even when we start talking more in depth about positive behavior intervention and supports this school year. We want to think about things like, is the environment optimal for learning? Could the environment in some way be, bringing about or evoking this behavior? Does a student have an effective way to communicate? Do they have words to say the things that their behaviors are saying for them? Depending on the age of students, are there enough opportunities for movement? Have we consulted with our occupational therapy department? No one can sit at their desk still for long periods of time. Movement is something that's very reinforcing. Fidgeting is something that is very reinforcing, especially when you're not able to do that for a period of time. So we want to make sure that we're checking in with our occupational therapy department, because these could be reasons that problem behaviors are occurring. And if we can just fix these antecedent wise, like putting in some sort of a movement schedule or giving them opportunities to get up, then we could, or giving them opportunities to fidget, then and reduce problem behavior that way, that would be great. That would be amazing. Are the materials clearly presented in an appropriate format? Like, is the student able to understand or comprehend what it is they're supposed to be doing? Are there clear expectations for that student? We've all been in situations where we really don't know what we're supposed to be doing when we're there, and it's very confusing and it's very hard. So we want to make sure that we're presenting clear expectations and that the expectations are appropriate. And then lastly, is the reinforcement effective? And just because a student likes something does not necessarily mean that that thing reinforces behavior. So I want to make that clear. I hear all the time that's like, oh, they just like, they don't want to work for their reinforcers. That sentence doesn't make sense because reinforcers are things that increase behavior. So if you don't see the behavior before it increased by that thing that you're using, it's not a reinforcer. Could be a preferred item, not a reinforcer. Can't do or won't do. And this is something that we need to determine. Are these things skill deficits or are they behavioral deficits? Skill deficits or motivation deficits. So when the student is not following directions, right? And a lot of people will use the term non-compliance to describe that. Is the problem behavior due to a skill deficit or a lack of motivation? Like, can they actually perform the skill if there was appropriate reinforcement, or do they not even know how to perform the skill? So we want to assess that. We want to determine, like, if they don't know the skill, then we need to teach it. So we need to model it. We need to prompt them. We need to provide that support using errorless teaching or whatever it is until that skill is learned. They're not behaving in the way that you want them to because they actually don't know how. And we need to think about those things. Like, do they understand and know how to perform the skill or the behavior? Sometimes things are just a motivation deficit. I hear that all the time. Well, they know how to do it. They just don't. So if they know how to do it and they don't, then we need to motivate them to do it, right? So maybe they get access to something immediately following it, right? So we call that the pre-MAC principle or grandma's rule or the first then rule. First you do this, then you do this. Sometimes we might want to set up some contingencies if there's something that a child really doesn't like to do or is not motivated to do. Maybe that's the last thing on their schedule prior to them, earning some sort of free time or a break from work or some sort of preferred activity. So thinking about how we can arrange contingencies so that we see the behavior that we want to see. Replacement behaviors. Replacement behaviors are behaviors that we want to teach that serve the same function as the problem behavior. So replacement behaviors can be alternate behaviors that are taught, like we could actually teach them. It could be a behavior that's already in their repertoire that serves the same function. Um, the biggest thing that we want to think about. So if a student, if we've determined that a behavior such as physical aggression is the function of it is a postponement or an escape from whatever activity that they're doing. The natural thing would be to teach them to appropriately postpone or escape. So maybe they say, I'm not ready to do this yet. Can I have a few more minutes? Can we do something else first? Right? There's a whole lot of different language things that we can teach within that context that we can reinforce and then provide them with that escape. One of the things that I want to mention really quick is I hear all the time, like, no, they have to do their work. Like, why should they not be allowed? Why should I allow them to not do their work for 5 minutes? And what I would say is, yes, that the goal is that they eventually start their work, initiate their work when we ask them to, but they're using their behavior right now to get out of that work. They're already missing it. They're missing it for 5 minutes. Would you rather them miss their work for 5 minutes because they punched you or because they asked nicely? So we really want to think about replacing those behaviors with the language and then reinforcing that language, making sure that that language is meaningful. If we don't reinforce replacement behaviors, they're not going to actually strengthen and get to the level that the problem behavior would get to. So really important that we're reinforcing those replacement behaviors. Okay. Functional communication training. So functional communication training, it's a replacement behavior training or an alternate behavior that focuses mostly on communication. And the example that I gave you guys before about escape and that child saying, can I have a few more minutes, or I'm not ready to start this, or can we do something else first, or I just don't feel like doing this today. That student can be taught to use that language that meets the same function. And the way that kids communicate, and I'm sure for those of you guys that are new, you'll learn very quickly. Some kids have SGDs, some kids have low tech boards, some kids have high tech boards, some kids might give a sign or use an adapted sign or ASL in order to communicate. Some kids are very vocal verbal and they will use their words to ask for things. But there's a lot of different ways that we can teach kids using functional communication training. But the whole point is that we're giving them the language to do it so that their behavior doesn't have to do it. So asking for help can be reinforced instead of having a meltdown when they're challenged, or a student can use a break card when they need a break from their work instead of whatever problem behavior they were engaging in. Group contingencies is also an antecedent intervention that can be used. I'm not going to go into great detail about this, but would be happy to talk with anyone if they're interested in a group contingency. The most well-known group contingency is the good behavior game. It sets up a point system and has teams kind of compete against each other in the classroom, and you're reinforcing desired behaviors. So now we get into the reactive strategies or consequent interventions. And these interventions are interventions that would follow a problem behavior to reduce the likelihood of it occurring again, or increase the likelihood of a wanted behavior or a desired behavior. Okay, so there's three basic principles that alter our behavior. There's three kind of outcomes whenever we perform any sort of a behavior that would either strengthen it, that would weaken it, or that would have sort of like that nothing would happen afterwards and by definition weaken it. So extinction, I'll talk about really quickly. Extinction is just no longer providing reinforcement for a behavior that's been previously reinforced until the behavior no longer occurs. The classic example of an extinction is the pop machine. So you go to the pop machine, you put in your dollar bill. Your your dollar bill, you press the button, you get a can of Coke. Okay. So that always happens reliably. 99% of the times you go to that pop machine or that Coke machine, you put in money and you get a Coke out. We've all been in those situations where we put our dollar in, we press the button, and nothing happens. That is an example of extinction. So previously, pressing that button was reinforced with the delivery of a Coke. Now, pressing that button, nothing happens. So things to think about with extinction. If we stop reinforcing a previously reinforced behavior, what happens with the Coke machine when we press the button and nothing comes out? We start to hit the button. We might start to kick the machine. We might start to shake the machine, right? So something to be aware of if using an extinction procedure is that it increases behavior. And there's a lot of times there is a increase in the behavior because it's like, what do I got to do to get this thing? How can you not give me this thing? So we really need to be aware of that when we're working with our kids. So here's some other extinction examples. So if the function of behavior is gaining attention, the extinction procedure usually is some sort of planned ignoring or just not attending to that behavior. So the learner's calling out, hey, teacher, hey, teacher, teacher's not responding to the calls. That would be an example of an extinction procedure. So when my son says, mommy, and I don't respond, and then he yells, mommy, that would be an example of an extinction procedure. If I pay attention to that yelling when he's yelling, finally, when he's screaming at me, I've just reinforced that higher level of behavior. So we want to make sure that when we're using extinction procedures, that first of all, that we're doing it in an ethical manner, right? We want to make sure that kids actually do have the ability to have that function met. But we want to be aware of the fact that behavior would probably increase. Another extinction example is escape or avoiding demands. And you would deny opportunity for escape or teach appropriate ways to ask for help. So a student throws up whenever he's asked to complete a new task to avoid the demand, and the teacher continues just presenting that task. Something to just note that escape extinction, there is a place for it, but it is really frowned upon for ethical reasons. So a lot of times we try to avoid escape extinction when possible. And I don't recommend, doing these things without talking to behavior specialists or behavior analysts. Another extinction example is if the function is to gain some sort of sensory stimulation or to avoid unwanted stimulation. It might be either interrupting and redirecting the behavior or changing the consequence, so it's no longer reinforcing. So if a learner bangs his head on a desk, the teacher puts a soft pillow to block that potentially reinforcing sensation. Gaining tangible items function, if you just deny that access to that material. So learner screams to get time on a computer, and that computer time is never provided, contingent on that screaming. Environment changes our behavior, and it's just something to be aware of when we're working with our kids. Behavior is either reinforced, punished, or put on extinction by the environment around us. These are natural phenomena that occur. There's things that we can do, contingencies that we can then put in place, but these principles just occur naturally. So when we think about an infant, laying in a crib with a mobile above her, and that infant reaches up and touches that mobile, and that mobile moves, and it might play some music, or there's that tactile and auditory, and they see the movement, or maybe there's some sparkles on it and they see the shining. That is preferred. That child looks up and does that, and it's like, oh, I like this. I can see it. It moves. So when they're sitting in their crib or laying in their crib in the future, they learn to start, moving their arms around to get the environment to interact with them. No one had to teach them to do that, right? That's just something that was learned and something that they liked. So when we think about Like babies are such a great example because everything that they do as they get older, they're learning from their environment. Oh, I should do this. Oh, I shouldn't. Think about walking, right? They have to learn how to hold their body so that they're not following all those things that they're doing, and the effects of it, that reinforcing effect is teaching them how to do these things. So there is reinforcement that is occurring and punishment that's occurring all around us at all times. And that's just something really important to remember when we're thinking about behavior analysis, because what applied behavior analysis is recognizing that these things are happening and trying to then derive some different contingencies to increase wanted and desired behaviors and then decrease some of those behaviors that we don't want to see. Okay, so we'll really quickly just talk about some case studies. And this is just to give you guys a simple example of some behavior and then like some potential interventions. So Sam is a 12-year-old student. He has difficulty with transitioning off preferred items that he's earned for choice time or for his break time in between work to the next activity on his schedule. When asked to transition, he will initially protest, but it escalates to hitting and kicking his teacher. An FBA indicates that in the past, Sam's behaviors allowed him to escape or avoid those transitions off those preferred items. So if this was an example of a student that you have, here's some things that you might want to consider. So is Sam aware of how long his choice is, right? Does he know when it's ending? Is there some advanced warning to him that like, oh, hey, this thing that you really, really like is ending? Think of you watching a TV. If someone just came in and was like, oh, time's up, you're done for the day, that's it, turned off your show in the middle of it, that would probably evoke some sort of a reaction from you, right? So we want to make sure that kids actually understand these expectations and that these things aren't abrupt, or no one likes things that happen abruptly. So how can we make sure that that's not happening? Does Sam know what's next on his schedule? Does he actually know what he's transitioning to? Is he able to demonstrate an appropriate transition? Like, is that behavior in his repertoire? Does he understand, oh, I hit this X, I close this program down, I stand up and I walk to my next thing? Is he transitioning to something that he finds aversive or hard? No one. If someone's like, oh, you got to stop watching TV so that you can do, I don't know, something, so that you can go start something that you really, really don't like doing. I don't know, cleaning toilets. Like, no, I'm not going to want to stop watching TV so I can start cleaning toilets. Like, that's not cool. Like, that's not going to be fun. So if someone's coming in and then saying, hey, Monica, I'm going to turn off your TV right now so you can clean toilets. Like, I'm probably not going to be happy about that. Might cause some arguing. I'm definitely not going to like that person that told me to do that. So just things to consider when we're thinking about these things. So what could we do instead? We can make sure that Sam knows what's on his schedule. He knows what things are occurring. We can make sure that there's some sort of visual timer for choice time. So like transitions can be very abrupt. So, hey, if I see this thing and I know when this is going to end, that might make it a little bit better. We can also provide advanced warnings. So saying like, oh, hey, Sam, just warning you, like you got a couple more minutes, or next time I come over here, your time is done. So that we can warn him of the transition. We could teach some sort of replacement behavior. So he could say, hey, can I have another minute? I'm not ready to be done with this thing. When can I earn this thing again? Right? Any sort of the language that would allow him to know that he's going to be able to come back to this preferred thing, or that he can extend time on this preferred thing. We could film and show and teach a video model of all of the steps that he needs to engage in order to perform this appropriate transition. We could reinforce appropriate transitions, right? So we could get a token board and say every single time you transition off in the amount of time that we want you to, you're going to get a token. And once you earn these tokens, you get to trade them in for this thing. And then we could ease into the transition using behavioral momentum. So maybe he doesn't transition. Maybe someone doesn't turn off the TV and tell me immediately to go clean toilets, but someone, turns off the TV and says, Monica, hey, I left a snack over there on that table. Go eat that. And then we're going to get started in a minute. So thinking about changing those contingencies a little bit. The next case study, Megan, she's an 8-year-old student. She doesn't like writing. During her writing session, she screams, she slams her hands down on the desk, crumples her paper, throws material. FBA indicates that in these moments, she's granted a break or a reset from her work, which entails going for a walk with her aide to de-escalate. And then she ultimately avoids her next writing session. So things to consider: is the writing work too difficult? Right? Do we have an appropriate expectation in place for her? Is she receiving enough reinforcement during this time period? Does the effortful behavior match the reinforcement? Right? People know all the time, like, you've all been in those situations where it's like, oh, hey, here's this job I have, I want you to do. And then it's like, oh, well, what's the pay? And they tell you, and you're like, no, I'm not doing that for that. So those things occur. So we have to make sure that we're applying the same principle for our kids as well. So is the things that they're doing, is it worth the thing that they're getting from it? Right. And reinforcement occurs, this is just not our students' example, right? All of us would not accept or do, errands or jobs for things that we don't think we're getting appropriately paid for, right? That is human nature and human behavior. So it stands to reason that a student getting, I don't know, 2 minutes of an iPad after an hour of work is not going to be enough to reinforce that behavior. So we really want to think about that for our kids. What is an appropriate amount of effort that they need to put forth, and like how are we reinforcing that? And is the magnitude of that reinforcement enough? And then lastly, we want to think about, is there motivation? So again, are the things that we're giving them, those preferred activities that are supposed to be acting like reinforcement, are they motivating enough? Or is it just like, nah, I just had that last session, I don't really care. I hate this and I'm not doing it. So we really need to analyze those things and understand if those things are actually going to reinforce the desired behavior or not. So some of the things that we could do for this for Megan, we could decrease the writing demand and slowly fade the demand back in. Maybe she just is not able to perform that behavior. Maybe it's the work is too difficult. So how can we change the demand of that work so that OT talks a lot about the just right challenge. So how can we decrease that demand and give her a just right challenge, a challenge that's enough that she's going to be successful with it? And then we can start to build back that demand as she starts to gain skills within that area. We can think about replacement behaviors. So teaching her to appropriately request that break from writing. So like, hey, can I start this in 5 minutes? Can I have a quick break? This is getting very difficult. We can use video models of appropriate asking. We can use visuals to, prompt that behavior, that asking behavior. We can increase reinforcement for engaging in writing. Like, this is really hard. Here's what you can do. We've had kids in the past that we've paired, like for sessions that are somewhat aversive for that child or difficult for that child, we've paired them with other things like, oh, hey, I know this is a really tough session, so you can have a snack during this session. We'll get a snack. As long as you're working, you can have your snack. So thinking about things like that, like, can we pair other things with those sessions that are more that we find the student or the learner doesn't want to engage in? And then if the demand is appropriate, we could think about not letting her escape the task. So maybe if every single day she's not doing this and we have decreased the writing demand, we say, hey, Megan, before you go, I don't know, and do this preferred thing, right? Before you are able to use the iPad, you're really going to need to, write these couple of letters. So we could do things like that. And as this escape extinction procedure doesn't necessarily mean that child is sitting at their desk and not able to get up and not able to move, but we can just make the reinforcement contingent on the behavior and that they're not getting that reinforcement until the behavior occurs. Reinforcement really has to match the effort. And that's kind of what I was just talking about with that example. If the problem behavior has a long history of reinforcement, that new alternative behavior that the student's learning, that thing that we're teaching them to do instead of the problem behavior, it has to result in a highly preferred outcome. It has to be valuable. It has to be worth the effort to engage in that alternate behavior. Learning how to do things is very hard. It's hard for all of us. It's unfamiliar. It can be difficult. So no one likes doing things that are difficult, right? None of us want to say, yeah, oh, I love doing things that are super hard for me and make me feel like not good about myself. So we got to make sure that we're using appropriate reinforcement in those instances so that students are going to want to be motivated to and want to put forth the effort. Token systems are another consequent intervention. Behaviors reinforced with pairing it with a token. That tokens become reinforcing by pairing or presenting it at the same time with a reinforcing item. And that token kind of becomes a promise that something even better is on its way. Tokens are later usually turned in or exchanged for some sort of backup reinforcer or reinforcing item. Money is the classic example of a token, right? We can take our money and we can buy lots of reinforcing things with our money. So that's a classic same example of what a token is. It's like, hey, I'm going to give you this token or this dollar. You can exchange it later for things that you want. Advantages of a token system is that you don't have to supply that reinforcing item immediately. Maybe that token is worth 1 minute on the iPad. And at the end of they get 5 tokens and they get 5 minutes on the iPad, right? So you don't have to stop and interrupt your session to allow 1 minute at a time, right? You can have them change in like, oh, let's see where you finished your board. Oh, you got 6 tokens. Great. That's equivalent to 6 minutes on the iPad. So there's less interference during that instruction. In a token system, tokens are initially paired the same, they're presented at the same time as that reinforcing item. And then after that successful pairing, the tokens then become the reinforcing item for the behavior we want to increase. So an antecedent is kind of like line up for recess. The behavior is the student lines up, and then the consequence is extra recess time paired with a token. We really want to make sure that our tokens are contingent on specific behaviors and not on a variety of behaviors. Really, the idea behind a token system is I perform this behavior and I get this token, not I perform all of these behaviors and I get this token. The more behaviors that you have included in your token system, the less likely it's going to be actually effective. Also, another thing with tokens is tokens are supposed to be valuable. So if I throw a bunch of tokens on the floor or leave the tokens in the vicinity and that child does not try to take them or grab them, then they're probably not reinforcing, right? If we walked by and saw a bunch of money on the ground, I'm pretty sure that all of us would pick it up if there was no one around. So it has the same kind of idea. What if the challenging behavior continues? Challenging behavior might still be being reinforced. So is everyone on board with the plan? So you've put in this behavior intervention, problem behavior is occurring. Is the behavior plan being put into place with some sort of procedural fidelity? Is the behavior still potentially being intermittently reinforced? The plan has to be the right fit for that student and manageable for the ones that are implementing it. So people have to be trained in it. They have to have the resources in order to be able to implement it. There needs to be buy-in from staff. Challenging behavior might still be occurring because it has a long reinforcement history and it's super resistant to change. If you've been doing that thing for so long, it is very hard to change behaviors. And I think that's something that we all have to be aware of. How difficult it is for us to change our own behaviors. Think of people who are like chronically late, right? How hard is it to change that behavior when you've been doing it for so long? It's extremely difficult. So we can't be super surprised when our kids' behavior doesn't change as rapidly as we'd like to see it. Because I'm pretty sure that every single one of us that's on the Zoom right now has some sort of behavior that we would like to change about ourselves that is very hard to change. And people hire, I mean, thinking about like fitness and working out, people hire people to, personal trainers or whatever to help them change their behaviors. And then sometimes they're still resistant changing behaviors. So approaching some of these things with a little bit of empathy, with a little bit of understanding that, hey, this is how this kid has learned to behave because of the things that other people have done in the past, right? They're not bad by nature. They're not, motivated by just, I don't know, pissing you off. They're not. It's just that this is how their environment has taught them to behave in the past. And that's really how behavior analysis looks at behavior. If you really want to be sort of empathetic and ethical in your practice. Potentially also alternate behavior is not learned or not being reinforced. There might be too much effort for the student. So sometimes items aren't as reinforcing or valuable to the student as we actually think that they are. Sometimes we're just, the behavior that we're asking them to do is way too effortful. And it's just like, hey, it's so much easier for me to do this thing that's worked in the past. We really want to think about using evidence-based interventions. So when interventions are recommended for problem behavior, we really want to look at the research on the effectiveness of that intervention. So does the research support the application of this intervention for this particular problem behavior in this particular context? Is it the best one for the student? Is it a good fit for the environment? Like, can it be carried out with some sort of fidelity? Is there data being collected so we can determine like, hey, this thing that we're doing is working or it's not working? And that we're making those decisions about changes in the BIP based on the data, not based on a feeling, not based on how we feel that day or how that child has felt that day, or I'm exasperated and can't do this anymore, so we need to change this, right? Looking at the data should be guiding our intervention. Some ethical considerations when we're thinking about behavior change procedures or planning for behavior reduction. Is the behavior a problem? There's been, I'll be perfectly honest, there's been some criticisms of applied behavior analysis in the past because ABA has focused in the past on some behaviors that are actually not problems. So does it interfere with the learning? Does it prevent the student from interacting with others? Is it kind of limiting their quality of life? That's really what we want to think about. Considering the effort of that alternative behavior. So again, the alternative behavior that replaces the problem behavior should not be more effortful than the problem behavior, right? If there's 6 steps for them to say the thing that we want them to say on their SGD versus I'm going to hit you or hit myself and get that same thing, that's a problem. We need to build up that skill. We can't have 6 steps at first. It has to be super easy for them to do in the beginning, and then we can make it more complex. But initially, it's got to be easy. And we want to think about minimizing the use of unhealthy reinforcers. In ABA, a lot of times, and with our kids, like who lack some of the motivation, who maybe don't have the skills for a lot of different leisure activities, whose leisure repertoires are very minimal. Those are things we should be thinking constantly of how to increase leisure repertoires. But we a lot of times use food to motivate. And we really need to be careful about that. We need to keep in mind like kids' weight. We also need to keep in mind that we're not like creating a really unhealthy kind of relationship with food for these individuals. So always keeping that in mind, and thinking about how can we limit the use of these food items or unhealthy reinforcers by pairing it with other positive things, like by pairing it with praise or by pairing it with, I don't know, time on an iPad or something like that. Okay, so I finished with like a minute to go. I talked really fast because I knew I had to get through this, but there's just some references in here. You can, I think this presentation going to get emailed out to people if they want it, Lauren?
It will be saved on the L drive and I'll
Saved
send
on
out
the L drive
to that.
Perfect. Great. And if you guys have any questions or you want to talk about behavior analysis or you have questions specifically about the presentation, just let me know. Okay. Thank you, guys.
Thank you. Please, everybody, hop on to Chris Carter's data presentation now. Thank you. Thanks so much, Monica.
Yeah.
Thanks, Monica. Thanks, Monica.